For people who have diabetes, or almost any other disease for that matter, the benefits of exercise can't be overstated. Exercise helps control weight, lower blood pressure, lower harmful LDL cholesterol and triglycerides, raise healthy HDL cholesterol, strengthen muscles and bones, reduce anxiety, and improve your general well-being. There are added benefits for people with diabetes. Exercise lowers blood glucose levels and boosts your body's sensitivity to insulin, countering insulin resistance. When you do moderate exercise, like walking, that makes your heart beat a little faster and you breathe a little harder, your muscles use more glucose. Over time this can lower your blood sugar levels. It also makes the insulin in your body work better. You'll get these benefits for hours after your walk or workout. In general, the best time to exercise is 1 to 3 hours after eating, when your blood sugar level is likely to be higher. It's important to test your blood sugar before exercising, especially if you use insulin. If the level before exercise is below 100 milligrams per deciliter, eating a piece of fruit or having a small snack will boost it and help you avoid hypoglycemia. Test again 30 minutes later to show whether your blood sugar level is stable. It's also a good idea to check your blood sugar after any particularly grueling workout or activity. If you're taking insulin, your risk of developing hypoglycemia may be high as 6 to 12 hours after exercising, so pay attention. On the other hand, if it's above 250 milligrams per deciliter, your blood sugar may be too high to be active safely. Test your urine for ketones. These are substances made when your body breaks down fat for energy. The presence of ketones indicates that your body doesn't have enough insulin to control your blood sugar. If you are physically active when you have high ketone levels, you risk ketoacidosis, a serious diabetes complication that needs immediate treatment. If it is between 100 and 240, and if approved by your medical team, it is a great time to get active. No matter what your physical limitations are, there are exercises you can do. Even slow walking does amazing things for us. Sitting in a chair and moving our arms or legs can stimulate the heart and have benefits. Any movement is great. Work with your medical team to come up with an exercise plan that is right for you. Now, some of the excuses we use to avoid exercise are: it's too hard. If you think being more active means hours at the gym, it's just not true. You can start by walking for 10 minutes after dinner, gradually building up to 30 minutes most days. The results take too long. Some benefits start right away, even if they don't seem obvious to you. Check your blood sugar before and after you take a walk. You'll likely see a lower number after the walk. If you stick with it over time, you will see even more obvious results. It's just not fun. It can be lots of fun if you find an activity you enjoy. Don't force yourself to do something you don't like. You won't stick with it. Try doing a new activity a couple of times before deciding whether to continue with that activity. If one activity isn't a good fit, don't give up. Try something else. It costs too much. The costs for gym memberships and fitness classes can add up. However, walking during lunch or after dinner, dancing to your favorite tunes at home, or working out to online videos are free, and can be done at times that are more convenient for you. It's hard to find the time. Find ways to squeeze physical activity into your day-to-day life. For example, take the stairs instead of the elevator, play outside with your children, get up and move during TV commercials. Try to fit in at least 20 to 25 minutes of activity every day, if possible, which will help it become a habit. I'm just too old. It's never too late to start being more active. Low-impact activities like pool walking and swimming are examples. Talk to your healthcare provider about activities that you can do to get started. I'm too out of shape. Start slowly and work your way up to your desired level. Add simple activities to your daily life like walking to your mailbox, or when you're running errands, park a little farther from the door. Discuss other ideas with your healthcare provider. There are, of course, special considerations for people with diabetes. Protect your feet by wearing cotton socks with well-fitting athletic shoes. Before starting any physical activity, check with your healthcare provider to talk about the best physical activities for you. Be sure to discuss which activities you like, how to prepare, and what you should avoid. Drink plenty of fluids while being physically active to prevent dehydration. Make sure to check your blood sugar before being physically active, especially if you take insulin. After your activity, test to see how it has affected your blood glucose level. After being physically active, check your feet for sores, blisters, irritation, cuts, or other injuries. Call your healthcare provider if an injury doesn't begin to heal after 2 days. Remember, the benefits of exercise include: usually lowers your blood sugar, improves insulin sensitivity, which means your body's insulin works better. Note, you may need an adjustment in your diabetes medication or insulin dose to help prevent the blood sugar from going too low. Ask your healthcare provider for advice. Reduces body fat, helps to build and tone muscles, lowers your risk for heart disease, improves circulation, preserves bone mass, reduces stress and enhances quality of life. So let's get moving. Starting slowly and doing what we can will help us get healthier and better control our blood glucose. Keep in mind that the old saying, "No pain, no gain," is a myth. Start slowly, gradually increase your activity as your fitness improves, which it almost certainly will with time. Good luck and good health.